5 warning signs of kidney disease that can be written all over your face. Number 3, generalized facial puffiness or facial edema, also called a moon face. Yes, this is another warning sign of kidney disease. And you will recall our patient, Bob, ended up having a generalized puffy face. He had edema of the face. If this happens, then this can definitely let you know that you might have kidney disease. Other things can cause facial edema as well, including severe allergic reactions, angioedema if you take a medicine like lisinopril or one of the ACE inhibitors and it causes your whole face to swell. So there are other causes of facial edema, but very importantly, you must consult with your doctor if you have puffiness of your face because it could mean kidney disease. Here's what happens. There's different mechanisms, and then I'll tell you what Bob actually had. One thing, if you get puffiness in your face or excess fluid all over the tissues of your face, that could mean that your kidneys are no longer maintaining the proper salt and water balance, okay? So especially if you have advanced kidney disease, if you have CKD stage 4, certainly CKD stage 5, then it can mean that you're no longer filtering out the excess water, the excess salt. You might be holding on to that salt and water, and so it's in your tissues. And so it can present as a generalized puffy face, a puffy stomach, a puffy back, puffy legs, feet, ankles. You can have generalized edema or anasarca, okay? So that's from holding on to too much water from the kidneys not working well. Another thing that can cause a generalized puffy face as it relates to kidneys is something called nephrotic syndrome. Nephrotic syndrome occurs when you're not just leaking out a little bit of protein in your kidneys, but when you're leaking out a lot of protein, like more than 3 grams a day. And just to put that in perspective, it is normal to leak out 0 protein or very, very little protein each day. If you've ever heard of those 24-hour urine collection tests where your doctor has you to collect all of your urine for 24 hours in a big red jug and you keep it in the refrigerator, that's a whole nother story. Where basically we want to make sure in those collections that your kidneys are leaking out a minimal amount of protein, certainly less than 300 milligrams in 24 hours. Well, for people with nephrotic syndrome, they are typically leaking out over 3,000 milligrams of protein in their urine in 24 hours, sometimes 5,000 milligrams, sometimes 15,000 milligrams, okay? And when you're leaking out this much protein, remember how I said that your protein in your bloodstream is like the sponge to keep the fluids inside? Well, if you're leaking out over 3 grams of protein in 24 hours, you can imagine that you really have no sponge left inside of your blood vessels. And so a whole lot of fluid can seep out into your tissues. And that's what can really lead to the puffy face, nephrotic syndrome. Be sure to check out my video on nephrotic versus nephritic syndrome right here on YouTube after you finish watching this video. There are many diseases that can cause a huge leakage of protein into the urine. The number 1 cause of proteinuria, diabetes. And yes, it's possible for diabetes or diabetic nephropathy to cause one to lose over 3,000 milligrams of protein in a day, which very definitely can lead to a super puffy face. Some other forms of kidney disease that can cause nephrotic syndrome include lupus nephritis or kidney disease caused by lupus. There are different forms of lupus nephritis. One is called a membranous type, and that can cause you to lose over 3,000 milligrams of protein in your urine a day. Also, a condition called FSG or focal segmental glomerulosclerosis. This is actually the most common form of glomerulonephritis among people of African descent. And then there's something called minimal change disease. Yes, minimal change disease. In this kidney disorder, the filter of the kidneys is definitely affected, and you have something called a podocyte effacement. Basically, the structure of the kidneys, the parts of the kidneys that are supposed to help to keep a barrier and to keep protein from leaking into the urine, well, that's pretty much destroyed. And you also get a problem with the charge of the kidneys. Okay, so the kidney filters typically have a negative charge, and we know that proteins also have a negative charge. And so if you take it back to science class 101, hey, let's go back, then you know that negative repels negative, right? So if you have a negative charge in the protein that's going through the bloodstream and a negative charge in the kidney filter, then that filter will repel the protein and keep it in the blood vessels, keep it in the bloodstream where it belongs. Well, in minimal change disease, with the destruction of the kidney filter, these different parts of the kidney filter, you no longer have that proper negatively charged barrier. So what happens? Honey, the protein just starts leaking and leaking into your urine. And then, of course, you lose the uncotted pressure. You lose that nice pressure of the protein acting like a sponge to keep fluid inside of your vessels. And so you get the puffy face, puffy body, puffy arms, puffy legs. So when you think about my patient, Bob, who initially had puffy eyes and went on to have a very puffy face, he actually had a diagnosis of minimal change disease. How do I know? I did the tested his urine. He had well over 4,000 milligrams of protein in his urine in 24 hours. Not only did he have a generalized puffiness of his face, he also had puffiness in his entire body. He had anasarca or generalized edema. We did a kidney biopsy where we took a sample of his kidney. And indeed, under the microscope, he had classic minimal change disease. Okay. That was his diagnosis. And you also recall that I shared that Bob was someone who normally kept a really tight look on his weight. Okay. He kept his weight within a tight range, a tight, healthy range, but then he put on a lot of weight. Well, the reason he put on so much weight was because he was holding on to excess fluid, right? He was holding on to fluid. And so he had gained something like 40 pounds of water weight, minimal change disease. He had puffiness. And so his kidney disease was written all over his face. If ever you notice that you have a puffy face, especially if it's mixed with puffy eyes, swelling all over your body, if you notice a bubbly urine or really foamy urine, like if you think about pouring a beer, or like the way it looks on beer commercials where there's that white foam on top. If you have foamy urine that looks like that, then that could mean that you have a lot of protein in your urine. So if you're getting any of these signs or symptoms, make sure you consult with your doctor right away to make sure that you don't have this type of kidney disease. Number 4, a rash on your face or an itching face. Yes, kidney disease can lead to you having itchy skin on your face, and this could be a warning that you have kidney disease. Your kidneys are responsible for filtering out a lot of things. They filter your blood out, they get rid of excess toxins. They also help to balance your electrolytes, and they help to get rid of something called phosphorus. Okay. We all encounter phosphorus in our foods. We have phosphorus in nuts. There's phosphorus in milk. There's also a lot of phosphorus in ultra processed foods. Okay. That's like a really great preservative, not so healthy for you. Well, if your kidneys are not filtering properly, then instead of you getting rid of the phosphorus in your urine, you will have a buildup of phosphorus in your bloodstream. And one of the effects of having a high amount of phosphorus in the blood, or hyperphosphatemia, is that it can lead to itching. And I don't mean just a little bit of tiny annoyance, pat itching. I mean an intense itching that will make you scratch, and it can even cause you to leave like scratch marks in your face or break the skin, have excoriations or scratches in that regard. And yes, this can happen on your face. It can happen all over your body. It can certainly happen on your face, and you can get little dark patches or a rash that are associated with high levels of phosphorus. And so if you're getting a rash on your face, itching skin on your face, then please pay attention. Oh, and there are things that we can do to treat the high levels of phosphorus in the blood. Number 1, we ask that you limit the amount of phosphorus in your diet. In most cases, the limitation should be less than 800 milligrams per day if you have advanced kidney disease. Consult with your doctor, consult with your renal dietitian. Also, there are certain medicines, certain phosphate lowering therapies that we can have you to take that can also lower the phosphorus in the blood. Number 5, an unusual dryness on the skin of your face, or even a frosted appearance on your face, uremic frost. Let's talk about this uremic frost, because this is very rare, at least in the United States. But if ever you have a uremic frost on your face, this is an emergency, okay? This is not something you sit there and contemplate. Urea is one of the toxins that your kidneys filter out. When you have very advanced kidney disease, you can get a buildup of urea in your blood. And if that urea, that BUN, blood urea nitrogen, if that urea builds up to excessively high levels, then it can start coming out of your skin through your sweat glands, and it can crystallize on your face, giving a powder-like appearance. This is a uremic frost. This is an emergency. You need to go to the emergency room or call your local emergency telephone number if ever you see uremic frost. Again, this is something that's very rare in the States, but it can happen. You want to be aware. Also, just an unusual dryness of the face. We know that the kidneys filter out excessive toxins, and certain excessive toxins or even electrolytes can cause your skin to be just brittle and just very, very dry. So if you have an unusual dryness on your face, or Lord forbid, uremic frost, then hey, these are other facial signs that you might have a hidden kidney disease. You know your body. You know your face. And so when things are changing, I don't want you to just sit home and contemplate and say, oh, maybe I'm just tired. Maybe I'm just getting older. Maybe. Yes, maybe a lot of things. But you want to make sure that you're not missing something as important as having kidney disease. Oh, there are many more warning signs and symptoms that can appear on your face and other parts of your body. The key thing that I want you to remember is that paying attention to every part of your body and everything that leaves your body, everything that goes out of your body, it's very important in order for you to pick up on warnings of serious diseases like kidney disease.